Welcome, welcome, welcome to this free training that we have for you today. I'm so excited to be here. Thank you guys so much for taking time out of your day and hopping on to Zoom here for this webinar. So one of the biggest questions that I get all the time, either whether it's online or through our website or anywhere, or if I'm in courses and I'm teaching pelvic floor physical therapists, this concept of what do I have, interstitial cystitis or pelvic floor dysfunction, always comes up. And I was in the process of creating a course for you guys that is all about taking you from the beginning to end of your IC journey. And I kept getting this question, and this question kept popping up, and I was like, you know what, this is like too good. I get this question too often, so I decided to pull it out of the course and give it to you guys here. So what we're going to do here is, first of all, welcome you, say thank you so much for being here, and now we're going to do a little bit of housekeeping. This is a new format for me. I've only done this one other time, and it was to a group of pelvic floor physical therapists. So I really want you to have a little grace with me right now. But this is number one, the replay, because you guys have registered here, the replay will be available. At the end of this webinar, we're going to be sending out an email so that you can access this recording. So that's going to be exciting. And one other piece of housekeeping, you guys are able to see me. I am actually not able to see anybody's faces. So from that perspective, it's pretty secure. What ends up happening is that we're going to go through this course. I've shared my screen with you here, and I can actually see, and if you allow everyone else to see, you can actually open the chat function, which somebody already has figured out, and you can actually, it's usually at the bottom of the screen. You just open, you click chat, and it will pop up with the Zoom name that you chose. So this one says it's an anonymous attendee. What I want you guys to do is actually set your settings at the very bottom. It should be to all panelists and attendees, or you can just do panelists. You can do it just to me. I would actually highly suggest that if you're going to have a question as we go through here, that you do it to panelists and attendees. So if you can change that setting right now, that'd be awesome, because I think that would help more people be able to be like, oh, I have that question too. So we already have one. If pelvic floor dysfunction is the cause, is there a bladder lining problem as well? We are going to answer this question when we get to that section 100%. So I want you guys to also, if you feel comfortable in that chat right now, just to make sure it's all working and everything, can you message me or message the panelists and say where you are tuning in from? I think it'll be kind of fun to see where everybody is from. So, yay, guys, this is so cool. Looking forward to the workshop from Orange County. That's Jesse, that's my husband. He's also on here as well. Tucson, Gettysburg, Toronto, Canada, New York, Kentucky, Michigan, Tampa, Florida, Upland, Oswego, New York, Seattle, New Zealand. Wow. Los Angeles, Houston. Can't get a full screen. Nicole, there's a small screen to the right. You guys, there's also a way to change the settings on the Zoom. So if you can't see me very well, then what happens is you just need to change the setting to a full screen mode. Wildemar, Los Angeles, Indianapolis, Spokane. This is so fun. I really, really, really appreciate you guys doing just hear from everywhere. This is so cool to see. And thanks to all you people where it's late where you are or early. So I'm going to keep this chat up. I'm going to keep this chat up too. And here we're going to get into it now. So if you guys have any questions on logistics, you can type them in there too. Jesse's going to be watching at least for half of it and be able to help you guys if you're having any issues. And now let's get into it. So just again, thank you so much. I'm really, really, really excited. So who is this for, right? I hope that if you are on this webinar that you are already well-versed in interstitial cystitis, although if you are a newbie to IC, then, you know, need to share your PowerPoint, we're getting your Chrome. My thing says I am screen sharing. Let me try stop share. Hang on, guys. How about now, everyone? Oh, sorry. Goodness gracious. Look, you guys, I'm so sad now. What we are going, let me get back now to this area. Now I feel like I have to start over. Okay, goodness gracious, you guys, screwing up. Much better. Mary Beth, thank you. Perfect, all set. Thank you so much. Goodness gracious, you guys. Okay, here we go. Let's start over. Welcome to the webinar for interstitial cystitis or pelvic floor dysfunction. What do I have? I get this question all the time. And it's one of the most common questions from physical therapists that I teach, and also from anybody that has interstitial cystitis, thinks they have interstitial cystitis, has been told they might have it, has been told they have pelvic floor dysfunction, but then they read on the internet that it might be IC, and it's all very confusing. So as we move through these modules here, thank you for being here. The housekeeping, we've already got that. The Netherlands, whoa, cool. Everybody knows about the chat function now. We got it good to go. Here we go. So who the heck is this training for? This training is for you if you are dealing with any sort of pelvic pain, urinary urgency, urinary frequency. Urinary urgency is defined by that really strong urge to go, kind of like you have a UTI. Bladder pressure is another really common description. Suprapubic pain, which are like pain or pressure right above the pubic bone. And urinary frequency is defined by technically if you're going to the bathroom more than 5 to 7 times a day. And I know that that is going to sound crazy to anybody that is dealing with these symptoms, because you're going to be like, I wish, right? You're going to be like, that would have been nice if that would have happened. But I'm sure a lot of you guys go multiple times a day. I've heard up into the 20s and 40s, even 10 at night. And it's really disruptive, and I get it. I have seen so many patients in your same shoes. This is also for you if you've been told you have interstitial cystitis, but you aren't quite sure you have it yet. This is actually really interesting. A lot of patients will go to their urologist, their OBGYN, and someone will throw that out like it's no big deal. Like, oh, you probably just have IC. Then you come and you're just like, what is going on? Like, do I really have this? Is this really the thing? And then you get the list of symptoms. Maybe you feel like you aren't diet sensitive. So you're like, well, I don't even know. Do I really have it? Was this guy right? Right? Does anyone else feel like that? I don't know if that resonates with any of your guys' story. I know that sometimes people also get told at the doctor's office, well, you might have IC, right? It's like, well, what is that? Aren't you supposed to be the physician? Like, could you just tell me? I'm sure many of my patients say that. They're like, what the heck? Am I all of a sudden the physician now? What do you mean I might have it? Can't you just do a test to see if I have it? And we're going to go into that in a second, because the answer is no. I hear a comment here from, I think, Virginia, that says, horrible urologist, right? Yes, I Sometimes they are. There are some good ones though. There certainly are some good ones, you guys. But they sometimes are few and far between, and it can be a little bit disheartening. So this training is also for you if you've actually been told that you have pelvic floor dysfunction, but you actually have been doing some research and you think it might be IC actually. So then it's like the opposite problem, right? You've done the research, you think they're going to say you have IC, they actually give you the diagnosis of pelvic floor dysfunction, and then you're like, what in the heck? Well, what do I have now? Do I have two things? Do I have none of them? How do we know what's right and what's wrong? Oh gosh, I know it's so frustrating. This is also really a good training for you if you feel like you have a UTI all the time, you test negative for infection, and you still have all this pain and discomfort, and you're wondering what in the world is happening to me? Why can't anybody figure this out? Why isn't it showing it up on the testing? What is going on? We will get to all of these questions. Keep asking these questions, you guys, because I see them coming in and I will get to most of them. So this is also for you if you are suffering and you're scared that this will last forever. And I don't know if that resonates with any of you guys, but that is, I feel like, one of the most overarching things that I hear from my patients is a lot of fear. And thinking that, God, is this going to be my life forever? Like, is this ever going to get any better? And we're going to dive into that just a little bit here. This main thing is to help to decrease the insane things that are going on in your head and actually bring some clarity to the differences and the similarities between interstitial cystitis and pelvic floor dysfunction, and what to do if you have both, what to do if you have either, and what to do just in general about it. So again, a lot of you guys, I'm sure, are feeling stuck, overwhelmed, alone, scared, sad, angry about the uncertainty of your symptoms and the lack of direction that you're getting for the people that are supposed to be helping you. It's another one of the things that I hear just loud and clear from all of my patients with interstitial cystitis is that this lack of direction that you're getting from the very people that you feel are supposed to be helping you can feel extremely isolating, and that's really scary. And I understand, I hear it from you guys all the time. It's one of the reasons why I'm so passionate about this condition, because I have seen great things happen for many, many, many people. And I just, want you guys to know that I'm here for you guys. I want you to not feel any of these things, even despite your symptoms, right? That even if you have interstitial cystitis, you shouldn't feel stuck, overwhelmed, alone, scared, sad, and angry. You should feel empowered and I've got this and you're on my team and let's do this together. Let's get rid of this. Let's live my best life I could possibly live. And that's what I want for everybody with interstitial cystitis. Some of you guys might be thinking, I want to turn off this webinar right now. This chick's crazy. There's no way that that's ever going to be how I can live my life. But I have seen it multiple times that healing with IC is not only possible, but it's also probable. And we're going to show you, and one of the first steps is in doing that is to understand this difference between interstitial cystitis and pelvic floor dysfunction. If there is one, what are you actually exhibiting and how and why? So in this training, you are going to learn the difference between IC and PFD, where there's an overlap in symptoms between interstitial cystitis and pelvic floor dysfunction, ways to communicate to your practitioners about your condition, and if you're frustrated, how to potentially change that, and how to advocate for yourself to make sure that you get the right care for your IC and or PFD, whatever we're calling it at the beginning of this webinar. And then at the end, you guys, we are going to open a full program for IC. If you guys follow me at all on social media, I've been teasing this with a lot of bloopers about, they won't be bloopers in there, but it's going to be called IC, Your Roadmap to Healing. It's basically going to be a personal roadmap for you to start or continue your healing journey. Remember, you guys, that there are multiple paths to get to your healing destination. So just like you're looking at a really intricate map, there are many ways that you can get to the end line, get to your destination. And that's what that course is all about. So I see all of your questions here. Let me just go through and get a couple of them. We're going to talk about the nerves. We are going to talk about the role of the nerves. We're going to get to that here in just a second. So I hear you on that, Paula. Lots of people from all over the place. Great. Let me look through some of these questions now. If we have pelvic floor dysfunction, Mary Beth says, does diet still play a role and an important part in making sure we avoid flares? This is actually covered a ton in that IC course that I just mentioned. We will go over it today as it relates to pelvic floor dysfunction. 100%. That is an excellent question. What is the role of painful nerves? When you're getting a negative infection test, will you be discussing low-lying undetected infection as a constant state of UTIs? I will go into that slightly. What else? We'll be discussing. Cool. I'm so excited you guys are on here. If we have pelvic floor dysfunction, does diet play a role? We already got to that. And if you have a negative infection test, but antibiotics are the only thing that works to get rid of it, what is up there? We got a couple of infection questions. That is pretty standard. Real quick, somebody said on there that the correlation between UTIs, which often preceded a nerve upregulation and triggered. Kendall Buster. Hi, Kendall. Good to see you on here. And then why is my pain worse side to side? I will go over that in a second here as well. And urinary urgency, stinging, and frequency. Got you. Okay, I'm all caught up, guys. Perfect. We had a question on here about whether or not you should see a urologist or a urogynecologist. I'm going to answer that question just real quick right now, actually. I personally like anybody, I don't care who they are, who knows about interstitial cystitis and has a heart for treating those patients. So whether that is most of the time, if you get a urogynecologist, if you're a female, or a urologist that specializes in pelvic pain, then those two places are the best sort of places for a doctor. Where we get a little bit more dicey is a urologist that only does prostate stuff and then has no idea about pain, mostly treats males and you're a female with IC, just all kinds of stuff like that. So I just really, the first thing is to make sure and to vet your physician to ask about whether or not they actually have this training, and are they a member of the International Pelvic Pain Society, and are they up to date on the AUA guidelines in the American Urological Association, and do they have stuff on their website about that they specifically treat interstitial cystitis? It's one of those things that I just really would rather have, I don't care what their title is, I don't care what their specialty is, but if they are a patient advocate, they're willing to work hard for you, and they know about IC and are willing to have it be a two-way street with you and the patient, that's who you want to be seeing. So even if it's a general practitioner that knows about IC, that can help you manage the condition, and maybe they can refer you out for some testing and then get back, cool. Whatever way it's going to work so that somebody is with you along this journey and doesn't dismiss you with this stuff. And there's a lot of I talk to a lot of doctors, you guys, and there's just a lot of doctors that just frankly don't care about IC. They don't want to be treating patients in pain. They will readily admit that to colleagues, right? So, but what they don't admit that to you is as the patient. And so it's just really important for you guys to understand that and to know that it's not out of the question for you to just move on to a different physician, different doctor, so that until you find your right match. So hopefully that's exciting that that's what you're going to learn in this course. At the end, we're going to open the full program and we're going to tell you what that's all about. You know, there is a better way to treat interstitial cystitis. It's not just about finding that physician for you. It's not about, you know, only doing medical tests. It's really about a holistic healing where you can make small improvements day to day. I love this quote from John Wood, and I'm going to open it with this. When you improve a little bit each day, eventually big things occur. Don't look for the quick, big improvements. Seek the small improvements one day at a time. That's the only way that it happens. And when it happens, it lasts. We have this plastered around my house, really. And then also we used to have this up in the clinic quite a bit. I share this with every one of my patients. This needs to be stuck on your bathroom mirror, on your car dashboard, everywhere, because so often we get stuck in waiting for the main diagnosis, because that's going to lead us to the one treatment, the two treatments that's going to rid me of this problem. And that is not how interstitial cystitis works, if you guys haven't figured it out already, right? It has to be a small steps every single day with somebody that's got your hand, that's like, come on, let me go with you. And, you know, that's where we can actually get some of this lasting relief that we're talking about. So for those of you guys, I'm just going to really quickly introduce myself to you guys, because there's a lot of people on here that I don't actually recognize the names. And when I'm in my Facebook group, Finding Pelvic Sanity, I recognize a lot of your guys' names. So we have a Facebook group called Finding Pelvic Sanity. That's probably where you guys heard a lot of this. But it's for anybody with pelvic floor dysfunction. And we are in there quite a bit, putting up videos and moderating similar to this, not as robust and pretty once I actually shared my screen with you guys. But, you know, for those of you who don't know me, my name is Dr. Nicole Cozine. I am a pelvic floor physical therapist, and I am a specialist in the pelvic floor and pelvic health in men and women. I graduated from University of California, San Diego with a bachelor's in physiology and neuroscience. I went to Chapman Physical Therapy School in Orange. I then got my WCS distinction, which is a pelvic health distinction through the American Physical Therapy Association. I've been a pelvic health PT for about 14 years. About 4 years ago, I wrote a book called The Interstitial Cystitis Solution. Jessie Cozine, who you'll see here on the webinar chat, is also a co-author on that book, and he helped me write it. He's one of the reasons why it's even readable, because I really am terrible at writing, believe it or not. And oh, Jema, hi. I had to tell my old PT about your book. Totally. Oh gosh, right? It's like, come on, people. But anyways, if you don't know about it, it's written for patients, right? It's written for you guys. But it is also really appropriate, like Jema just said, that you can give it to any practitioner. Everything in there is evidence-based. Lee, I got your question. I will go over that here in a second. And it totally is like a roadmap for your healing as well. It's like basically the course in book form, but it's very evidence-based. So any clinician could also read it and know that is, oh yeah, that's research-based, that's evidence. I've heard of that study, whatever. So it's really good. I also treat patients. I've always treated IC patients. I used to work for a hospital system. I started a pelvic floor program at Hoag Hospital. I worked with a urogynecologist there that treated IC a ton, and that's how I sort of got into treating interstitial cystitis, was that he completely was feeding me interstitial cystitis patients when frankly, I didn't know what the heck to do. And I had such a passion for helping patients that I was like, well, if I don't know what to do, someone's got to know, because this doctor is just giving them to me and I got to figure out what's going on from a pelvic floor standpoint. So I just dove in, and I dove into research, and I read, and I just did so many things about, learning about it. And I started to come across and get really frustrated about how much misinformation was also in this space. And I was reading contradictory things, and thank goodness I wasn't in pain, and I could actually discern with my clinical background of like, which is kind of bad information, which was good information, but I couldn't imagine having to do that as a patient. And I have a lot of empathy for you guys that are going through things like that. So I always knew that I wanted to specialize in pelvic pain. I wanted to always be able to help patients. So I worked for, 10 years in Orange County. And then I started my own clinic about 4 years ago. It's called Pelvic Sanity. The name is not an accident. I founded it on the basis that I wanted to restore sanity for you guys as patients and treat the pelvic girdle. So I named my clinic Pelvic Sanity. Right now we have 4 physical therapists, a massage therapist. Jesse works with me at the clinic, and we have a robust out-of-town program. We also have a remote consultation program. We have seen patients from 6 continents, 15 countries, and 25 US states, including a ton of places all around Los Angeles, Orange County, where we are, in San Diego, even San Francisco. So we've really helped a ton of people with this condition. I have a huge passion for treating people with IC or IC-like symptoms. And I love to help you guys see the light bulb and know that you're in good hands, that this doesn't have to be as scary. I'm going to help you. We're going to do it together, and we're going to get this pain and these symptoms under control. The first sentence of my book is, thousands of people live healthy, pain-free lives with IC, and so can you. I truly believe that. I've seen it happen. And when you have a good team involved, we can get you guys so much relief. There are things, for those of you guys who don't know me, who haven't been here, I just wanted to put this up here. Jill Osborne has, said that the IC Solution is a great book. Gary, who did a remote consult with me, says, don't suffer if you're not making the gains you should. Reach out, be your own best advocate. I love him. He is such a nice guy, and he really felt empowered after talking to me. We can't recommend it enough. We live far away. Don't suffer in silence. Help is available, and there's so much hope that you can get better and you don't have to suffer anymore. I really, really, really want you guys to believe that healing is possible for you. And I spend so much time trying to bust interstitial cystitis myths about the condition. And because the more that we internalize these myths that there is no cure, I see as a terrible disease, and it's not to say that you guys don't go through some gnarly symptoms and some really bad days and even years, but there is so much room for improvement. There's so much room for healing. And I hope that this training will help to sort of give you some clarity as to what other things might be causing your symptoms. What do you really have? And we're going to ask you for a little bit of a mindset shift here as well as we go through. So we are going to Mara, so we're going to end up going over that. Your book saved me. It gave me lots of confidence in both my primary care and my PT because the treatment plan matched what is in your book. That's awesome. I'm so glad to hear that. I'm really glad to hear that. We're also going to say, yay, you get the book on the 29th. Yay, Elizabeth. Awesome. Okay, so here we go. Now we're into it, you guys. Let's go. What do I have? IC or PFD? I know this is a question I get a ton. We're going to go through what in the world is all of this business. What is IC? What is PFD? What are the similarities? What are the differences? How can I tell which one I have? Does it actually matter, or am I just beating my head against a wall for no reason? And how can I still get better regardless of what it's called? The other thing that's also confused with interstitial cystitis and pelvic floor dysfunction is overactive bladder. So that's one other thing to throw into the mix. I don't know if any of you guys else have gotten diagnosed with overactive bladder from somebody. Again, that's just if you don't have pain, then people also automatically assume that you have overactive bladder. So interstitial cystitis has two components, two main symptom presentations: pain and urinary symptoms. It can be pain with urination as your only pain. It can also be pain in anywhere else in the lower abdomen, low back, groin, testicular pain for males, labial pain for females, urethral pain, clitoral pain, penile pain. Any sort of pelvic pain is one of them. And then urinary symptoms, which is urinary urgency, which is the kind of abnormal, really strong urge to go, like you absolutely cannot wait, sometimes even accompanied by incontinence, and urinary frequency. Interstitial cystitis and painful bladder syndrome, we're going to use those combined, is a diagnosis of exclusion, meaning there is no one test that can say definitively you have IC. Excellent question. Can it be pressure, tightness, and not pain with no urinary frequency? That's where it gets confusing, right? And it's like, what the heck? And that's where we're going to go into that in a second here when we talk about pelvic floor dysfunction. But in general, that pain category should be much more broad than what we're thinking about being like, ouch, it hurts, right? It can be abnormal pressure. It can be spasmy. It can be a feeling of overwhelming tightness in the lower abdomen. And this is where everybody's pain experience is different, which is why it's really important to communicate well, or just communicate exactly what you're experiencing to the physicians. And if you say pressure, tightness, then you might want to also describe it as a symptom bother or some sort of a pain threshold, because really at the end of the day, then sometimes that in one person would be considered pain. They go in with those same symptoms. They get told that they have interstitial cystitis. You get told that we don't really know, right? So it's that. I hope that answers your question. We're going to go over whether those disorders appear suddenly. But yeah, I hope that answers the question about the pressure, tightness, and pain. I think that everybody needs to have a little bit broader definition of what that pain actually is. And again, it can be no pain at all, but painful urination or urethral spasms, right? Which you might not think of as, oh, I'm in chronic pain every day, but you still have those urinary symptoms along with painful urination, and that can still be within that diagnostic criteria of interstitial cystitis. So you can test with cystoscopy, you can test for the presence of other conditions that can be causing IC-like symptoms, with the caveat that if you have true Hunner's lesions, which is only less than 10% of people, the most recent stats say 5 to 10%, if that can show up in the cystoscopy as a Hunner's lesion. If that happens, then you can be technically diagnosed on cystoscopy. If you don't have Hunner's lesions, which is over 90% of people with interstitial cystitis, it still is considered a diagnosis of exclusion, meaning you don't have something else, you don't have bladder cancer, you don't have an infection, and then you're sort of left with these symptoms. We can deem it interstitial cystitis. And we're going to go into what we can also deem it here in a second, where it makes it more confusing. I have bladder glomerulations on hydrodistension. So does that mean not PFD and the problem with the bladder itself? We're going to talk about that here in a second. I have a horrible flare now with increased pain, urgency, frequency. I have a low level of leukocytes on dipstick and urinalysis, but not an infection cultured. It's an interesting case. We will talk about that here in a second. Legs feel tight and heavy. That includes pain after urination. We definitely can have those pain symptoms that are a little bit more diffuse, a little bit more leg pain even, and urinary symptoms. All right, so that's technically what interstitial cystitis is. Now we go to the definition of pelvic floor dysfunction. And now hopefully that you can see that interstitial cystitis, painful bladder syndrome is a really big term that encompasses a lot of symptoms. So is pelvic floor dysfunction. Pelvic floor dysfunction is also a really broad term. Pelvic floor dysfunction describes a slew of symptoms that involves the functions of the pelvic floor. So I'm going to show you guys here really quickly this pelvic model. And hopefully we can see here that. Now I'm going to show you a female pelvis, but for any males that are on this webinar, this is actually exactly the same for both males and females. It's just that where the vaginal opening is where the base of your penis is. And the urethra here is obviously longer as it goes through the penis. As we go here into these ischial tuberosities or your sit bones, there's this little area called the urogenital triangle. It's in both males and females, all right? So as we do this, we're going to talk a little bit about where your urethra is and where the perineal body is, all right? So this is known as your pelvic floor. There's also a deeper layer of pelvic floor muscles that's more around the rectum. And then this is where your bladder and urethra come out right here. So hopefully you can see that. And then the pelvic floor actually is a sling between the pubic bone and the tailbone, all right? So it goes sling here, and then it also goes sling here. So as we go through any one of these pelvic floor muscles can actually cause urinary urgency, frequency, and pelvic pain. It can also cause bladder pain. And then we're also going to go over a slew of other symptoms that it can go over too. So the pelvic floor is responsible for sphincter control, for sexual functioning, for supporting the pelvic organs and actually supporting the bladder itself, right? So all your pelvic organs are in here, and you guys have a prostate that's right underneath the bladder. And it also is good for stability of the spine. So we have the end of our spine here, we have sacrum here, right? And so we have all of that going on as well. So these muscles also stabilize the spine. So when they are dysfunctional, they can also cause SI joint pain. They can cause back pain. They can cause sit bone pain here. They can cause pubic bone pain here. So as we move forward into what actually is pelvic floor dysfunction, right? Pelvic floor dysfunction is a broad term. And I want you right now to sort of see, can you guys identify any other things in your symptom presentation that actually can be caused by the pelvic floor? So things like lower abdominal pain, pubic bone pain, pelvic girdle pain. Someone asked about pudendal nerve. So pudendal nerve irritation, pain with sitting, perineal burning. Perineum is the space for males and females that's in between the base of the penis or the vaginal opening and the rectum and anus. So it's this little area where my finger is right here. That's called the perineum. So pudendal nerve irritation can actually cause that. And can also be irritated with pelvic floor dysfunction. Urinary symptoms. Your pelvic floor can cause incontinence, urinary urgency, urinary frequency, hesitancy, pelvic pain, orthopedic pain, low back pain, hip pain, sciatica, tailbone pain, groin pain, SI joint dysfunction. You can kind of see a pattern here, right? I'm sure that many of you guys can, and gals on this call, can see some of your other symptoms other than bladder pain and bladder urinary urgency and frequency on this list. Pelvic floor dysfunction can cause constipation, can cause fecal incontinence, can cause pain with bowel movements, can cause incomplete emptying, can cause sexual dysfunction, can cause pain with arousal, pain with erection for males, pain with penetration for females or same-sex couples, hyperarousal, PGAD-like symptoms, right, where you actually feel like you're on the verge of an orgasm. Pelvic floor dysfunction can cause any one of these symptoms. It can also cause a multitude of these symptoms. And the reason why they can do that is because they sit, like I just showed you, in this pelvic girdle area. So I'm going to take the organs out here for a second. And now we have this pelvic bowl here. Any one of these muscles can be dysfunctional, meaning usually with any pain condition, we have a spasm in there, right? And so what we end up doing is that these muscles can cause pain in and of themselves, and they can also cause bladder pain. And your bladder literally sits right on the backside of your pubic bone and right on some of these deep pelvic floor muscles. So any pelvic floor muscle here can actually irritate the bladder, and it can cause symptoms of bladder pain and pressure. It can cause tightening of the bladder. It can cause you to feel like it's coming from the bladder lining itself. Our bodies, by design, do not have very good discernment of where the pain is coming from when it's hurting. So we can have bladder pain, but we can also have pain in these muscles or dysfunction in these muscles. And your brain literally does not know how to process pain there. It just knows that it's irritating the bladder, and that is going up to your brain and saying, my bladder really is painful, or my pubic bone is really hurting. And that's right where my bladder is, right? So my bladder then hurts. So my point with pelvic floor dysfunction is that it can cause the same symptoms of interstitial cystitis. And this is where it gets confusing. So the other things to think about is in terms of like what the pelvic floor actually does is that it is also attached to your tailbone. So I don't know if any of you here have actually fallen on your tailbone or fallen in any sort of way to hit this area of the pelvis. A lot of times I hear from my patients that they fall off a bike and maybe the bike seat goes right there. Maybe somebody pulled a chair out from under you and you have a tailbone injury, fell downstairs. I've heard people not in Southern California fall on ice and have pain in that region as well. And what ends up happening is that these pelvic floor muscles then become conditioned to brace and tighten, and that can cause all of these pelvic floor muscles here to become hypertonic, we call, and then sometimes in some people that can actually cause bladder irritation, urinary urgency frequency, pelvic pain, along with any or all of these other symptoms. And so that's where I kind of want to bring your mindset outwards a little bit, that pelvic floor dysfunction, a lot of times people think that if you've been diagnosed with interstitial cystitis and you have these other conditions, that they are actually two separate things. And then that can be overwhelming, right? Because now I have a little bit of nerve irritation here. And gosh, now I think I have penile neuralgia. And then I have sciatic nerve pain. Great. Now my back's giving out on me. And now I feel like I can't empty my bowels. And I also feel like I have to pee all the time. Now that's another problem. But what I'm talking about here with pelvic floor dysfunction is the realization that once your pelvic floor is irritated and mad, these guys can cause any of these symptoms. And so some things that you might be thinking are actually separate issues can actually be interrelated with your urinary symptoms, and they can be interrelated with your bladder pain symptoms. And so I hope that that can start to get your little brain turning here about, maybe I have pelvic floor dysfunction, and maybe I have interstitial cystitis. Maybe I have both. Do I? Maybe I don't have either. So when we're asking, the title of this webinar is, what do I have? IC or PFD? And as we were just in here, it's pelvic floor dysfunction can cause all this. Interstitial cystitis is actually defined as these things right here, which are really close, you guys, to pelvic floor dysfunction. And so what I want you to start to do take an introspective look right now in, what do I have? I want you to ask yourself, and I want everybody to kind of do this right now. I want you to ask yourself, what are you afraid of having the most? What gives you most anxiety about this answer? If someone told you that the treatments for both were the same, would you care what it is? And there are no wrong answers here, you guys. This is a big, after treating patients for 14 years that have been diagnosed with IC, that get all confused about whether they have interstitial cystitis, pelvic floor dysfunction, both or neither. I always ask this question to my patients because there are some people that need to know, what is this? What is it? I want to know what it's called. I want to know what caused it. I want to know what it is. It helps you to decrease your anxiety to actually have a definitive diagnosis. There's a whole other camp of people, and you need to think about which one you fit into, where they don't want to have a label, and I don't want IC. I don't want to have pelvic floor dysfunction. I just want to know how we can get these darn symptoms to go away, and I could care less about what it's actually called. And so what we're going to have to do a little thought experiment is like, if the treatments for both are similar, then does it matter what we have? And that, I don't know. The answer, we're going to go over the answer here. I don't know what that means for you, but I want you to know that there are two major camps of people and a little bit of people in between of, I need to know my definitive diagnosis because I have massive anxiety if I don't know what's causing it, or I don't want to have anything to do with that diagnosis at all. I just want you to tell me how I can get these symptoms better, and I don't care what I have. I don't want to read one more thing about interstitial cystitis. So as we sort of go through this, then I want to then have you think about this answer. And as we go through, we're actually going to talk a little bit more about how these things can actually be intertwined. I hope that you can already start to see that a little bit. But there is an interstitial cystitis and pelvic floor dysfunction cycle. And some people have it start with pelvic floor dysfunction and move into urinary urgency, frequency, and bladder pain. And sometimes, for whatever reason, an infection, a real infection, a UTI-like symptom, another vaginal infection, a prostate infection, some other sort of inflammatory process going on, potentially irritation from something like IBS, some other thing that irritated your bladder and that started with bladder pain. So there are two major camps of people, something usually where something started, usually deemed as all of the sudden with UTI-like symptoms, or it started with pain and then transformed into this bladder pain cycle. But I want you guys to understand with this training today that interstitial cystitis and pelvic floor dysfunction are intricately connected. This explains the research that has been shown that 90% of people with interstitial cystitis have PFD. Does it mean that pelvic floor dysfunction caused your symptoms? Not necessarily. Does it mean that having interstitial cystitis causes pelvic floor dysfunction? 90% of people, the answer is yes. So the brain, the bladder, the pelvic floor, and the nervous system are all involved in this cycle. It is extremely important to understand this cycle and sort of start to identify where you may have entered this cycle. So as we move forward here, right, I'm going to make it a little bit bigger. So we're going to start, let's say, with, because there was a few people on this call that had a significant history of tailbone injury or a fall on your back, a car accident perhaps, back pain perhaps that started out and creeped down into this lower area where it hurt to sit, right? That can all be anything that's on that list, independent of whether or not you had urinary symptoms at the time. If you had bowel dysfunction, if you had nerve irritation, if you had anything else, then we can start you in this category that you potentially had some sort of pelvic floor dysfunction, some sort of discoordination, some sort of pelvic pain. This also goes for anybody that had a lower abdominal or pelvic surgery, someone that had a hysterectomy, someone that had a hernia repair if you're a guy, or a female can have a hernia repair too, someone that had a groin strain, or a groin injury, or testicular pain, any sort of pelvic pain in that category, potentially you started here in this pelvic floor dysfunction category. Then you moved on where all of a sudden those muscles are like, what in the world? Boom, I am contracted, I have high tone. Now you're in the pelvic floor dysfunction category. There's even more attempts then to protect this area because either it doesn't want to have what just happened, either fall, a surgery, there's inflammation now there's more pain, now we're trying to protect again. And because these muscles control urination and control defecation, then if you have high tone pelvic floor, then you can end up having a discoordination when you go to urinate. And it can start out super slow and you can start out almost imperceptible to you, but it can start. And then you have this painful voiding and slow relaxation of the pelvic floor muscles. And then you get where you don't fully empty your bladder potentially. And then your inefficient emptying of the bladder, your brain, remember I said it's not that smart. Your little bladder is not that smart. All this little guy knows how to do is say, I have to pee, or ouch. That's it. There's no like higher level thinking about this being like, well, actually, I think that the pelvic floor is squeezing on me and it's not me that's actually the problem. It's actually just my pelvic floor muscles. So I'm going to go ahead and calm down. That's really not what happens. And so your bladder gets irritated from either incomplete emptying or this increased pelvic floor muscle spasm. And then the inefficient emptying of the bladder goes up to your brain and is like, dang, that is not working. I better tell her or him he needs or she needs to go to the bathroom more. So you get more bladder pain, more urinary urgency, more frequency, more pelvic pain. And then we have more pelvic floor dysfunction, right? And so we're in this cycle. So I don't know if that sort of resonates with any of you guys. If we go back and look at all of the different things that the pelvic floor can actually influence, you could have had your start with pelvic floor dysfunction with a childbirth injury, with back pain, with sciatic nerve pain, with a hip injury, with groin strain, with anything like that. And for a lot of people in this world, that doesn't manifest in this way. Sometimes it goes more just into the back pain route and just goes into just normal other back pain, or normal other, that your pelvic floor ends up just sort of clearing itself up, and you end up having just some aches and pains every once in a while when you lift something. That was an option. Your body, for whatever reason, for a lot of other reasons, probably didn't end up going that route and sort of entered this cycle. So now I'm going to describe another scenario where you maybe didn't have pelvic floor dysfunction at all. You're just going through your life, skipping around, loving it, and boom, you have a bladder infection, either real or perceived, right? You have inflammation to the bladder. Maybe you have a yeast infection. Maybe you have, if you're male, an actual prostate infection or something that irritated your prostate. Maybe you ate something that was kind of like, ooh, that didn't really work very well. Maybe it was a normal bladder irritant that for whatever reason, in that instance, your body perceived it as bladder pain, urinary urgency, and frequency. And it was like, get whatever they just ate out of here. Get this low-grade UTI that didn't show up on a urine culture yet. Get that out of here. Let's have her flush out, or let's have him flush out the bladder. And so that, because the things that control bladder function are also intricately connect with the brain and your nervous system and the bladder, then that in and of itself can lead to pelvic floor dysfunction. And then we're in the cycle, right? The other scenario is that potentially you had a car accident, something completely unrelated to your bladder and your pelvic floor, or you have history of some sort of a trauma, stressful event, death in the family, surgical insult that had nothing to do with your bladder, but boom, your brain perceives a threat in that area, and boom, now all of a sudden, again, if there's a threat in this area, then all your body knows how to do is protect. Boom, we have a tight pelvic floor, you get pelvic pain, and then you can start into that from that area. So there's more either, and this threat is either here or this threat can be here. And so really there's a lot of ways to enter into this intricate web of interstitial cystitis-like symptoms and pelvic floor dysfunction. So I'm going to pause here for a second. I'm going to double check the questions to make sure that I'm answering them. Here's a good example. An anonymous person says, I'm your patient and I found out I have scoliosis and spondylitis, which causes all kind of back pain lately. Any help welcome. So in this situation, right, that would be in the pelvic floor dysfunction category. People with low back pain, there's a study, recent study actually, that showed that 95% of people with low back pain also have pelvic floor dysfunction. So that's another entry point into this thing. Can scoliosis cause IC? I wouldn't go so far to say that. Can your back cause pelvic floor dysfunction that can cause interstitial cystitis symptoms? 100%. And if anybody tells you otherwise, they don't know the anatomy, because this is a very much a well-known fact that most people just don't put all the pieces together. We know that if you have bladder pain and urgency frequency, it can lead to pelvic pain. We know that high-tone pelvic floor can cause painful voiding and slow relaxation of the pelvic floor muscles. But sometimes where we as medical providers stop short of helping you guys is to understand this entire loop and understanding where you guys can enter. And that kind of explains hopefully most of your guys' stories in some form or fashion. Placing together your pelvic health history, the initial symptom onset, maybe describing either for you why it started all of a sudden, if you had maybe an insult to that area, or either in a surgery or a UTI that wouldn't go away, something like that, or an infection or some other sort of irritant or irritation, inflammation problem. Maybe you already have an inflammatory condition and that inflammation has sort of made your bladder more irritable, and therefore it causes dysfunctional voiding, which then causes pelvic floor dysfunction. There are infinite amount of permutations into how you can have entered this interstitial cystitis pelvic floor loop. And this is not to overwhelm you. This is to give you some empowering picture, have you take a little bit of a bird's eye view to your way that your symptoms started and how you got potentially into this cycle. So I'm going to ask you guys really quickly as we talk about what to do about it and answering the question, so what do I have, IC or pelvic floor dysfunction? I'm going to ask you guys to have an open mind with what I'm about to say. I also want you to think about what your answer was when I said, what if I told you the treatments for both are exactly the same, right? The real question is, to the what do you have question, is does it really matter? If you have interstitial cystitis causing urinary urgency and frequency and pelvic pain, and your treatment ends up being a multifactorial approach to find the underlying why of your symptoms, and remember, 90% of people with IC have PFD, and so do 95% of people with low back pain. Or if you have pelvic floor dysfunction causing urinary urgency, frequency, and pelvic pain, and your treatment is a multifactorial approach to find the underlying why of your symptoms, the treatment is essentially the same, with potentially little diversions on your roadmap to healing of addressing maybe some bladder irritants or some diet issues, or maybe addressing your endometriosis, or maybe taking care of that old groin strain and that testicular pain that you never told anybody about because it's embarrassing, or maybe looking at a little bit of that sexual dysfunction as a preceding factor to your pelvic floor dysfunction or your urinary problems. But if ultimately the treatment is the same in order to get lasting relief, we need to treat the symptoms that you have, and we need to treat the pelvic floor dysfunction component, whatever that is. And so what I'm going to ask you guys to also do now is to take a look at this contributing factors to my symptoms. So what we're going to end up doing is looking through here, and really what we want to be doing is finding the why of your pelvic floor dysfunction. So here what we're going to do is I want you to start to think about this contributing factors to my symptoms. You have pelvic floor dysfunction, you have orthopedic dysfunction, you have nervous system upregulation or stress, organ dysfunction, either with your with your bladder, your uterus, your prostate, or your colon, right? Any bowel dysfunction, anything like that, stress, poor sleep, lack of movement, nutritional deficits, bladder irritants, anything like that. And we're actually going to think about what percentage do we feel like you have? Do we feel like it's 30% stress? Do we feel like it's 50% pelvic floor dysfunction? Do we feel like it's 10% diet, 10% something else and 10% something else? You guys get the picture. I want you guys to start to think about this and use it to potentially think about how you want to think about the things that you need to actually hone in on for your full healing with these bladder symptoms and pelvic floor. So I am I'm hoping that this is helping you guys to sort of see that from a practitioner standpoint, from I'm going to treat you individually. We're going to look at all of the contributing factors to the current symptoms that you have. We have to look at the underlying why of why those symptoms are there in the first place and address and treat those, right? So if it's a hysterectomy, if it's a C-section scar, if it's your groin strain, if it's your sciatic nerve pain, we also have to deal with that, right? In order to get your urinary urgency frequency and any sort of pain thing that you have in your pelvic girdle to go down. So it might matter to you. Now I want you to go back and think about when I asked you to think, does it matter for you if you have a definite diagnosis? If it does, then you need to talk to your healthcare practitioner and pin them down onto what do I actually have. I have that conversation back here with a lot of my patients all the time where I ask them, they say, what do I have? I see your pelvic floor dysfunction. I say, does it matter? How much of a, does it matter to you to have a definitive diagnosis? Are you going to feel better if you have that diagnosis, or are you going to feel worse? Right? Because at the end of the day, if it's going to make you feel worse, that you have more anxiety, then we need to think about it in a different way. And that's where I'm asking you to have a mindset shift. I want you to look at it as your symptoms of urinary urgency, frequency, and pelvic pain, and as a pelvic floor dysfunction issue that can be contributing to that urinary urgency and frequency and pelvic pain. And then we can start to actually address the why of what those problems are, instead of caring so much, whether it's pelvic floor dysfunction or interstitial cystitis, and this person that doesn't know anything said it might be IC. At the end of the day, you guys, the treatment ends up being very similar. Now, I will say this, there are some diversions if you have Hunner's lesions, right? If you have true, food sensitivities, there are some diversions there. And I had a couple of questions come up about, can you have interstitial cystitis and be not diet sensitive? The answer is yes. Can you be diet sensitive and not have IC? The answer is yes. Right? Again, it's all about finding some of that root cause of what that sensitivity is. And so here's the other thing to think about. Sometimes, for instance, I can have coffee, and that bladder irritant, which it is a diuretic and a bladder irritant for everybody, does not cause any problems for me. And it might not cause some problems for you. But what it does in some people, if your nervous system is upregulated, if you're in this spiral of pelvic floor dysfunction and interstitial cystitis, right? If you're in that cycle that we just talked about, then guess what? Your pain is going then to become more, your pelvic pain is going to become more prominent, because your nervous system is already upregulated from something else. But now you drink that coffee, and is it actually the bladder lining? We can help you to figure that out, but it might not be. What if it's not? I guess I'm asking you to think like, what if it's not? What if your interstitial cystitis symptoms is 90% of your pelvic floor dysfunction? What if it's 10? What does that mean? And I want you guys to start to open your minds and broaden your look at this issue, because what we do know from the research that has been going on in the last 5 years is that it is not one thing. Interstitial cystitis, urinary urgency frequency, painful bladder syndrome, whatever you want to call it, is not just one thing. It is a combination of pelvic floor dysfunction, usually, nervous system upregulation, and the disruption that those two things combine happen that disrupt your brain-bladder connection. This bladder to brain does not work well because of, and you need to be asking yourself, why? Why doesn't that work well in my body with my pelvic health picture with my other contributing symptoms, with my pelvic floor dysfunction, with the fact that I used to be a soccer player and fell on my tailbone when I was 12. You know, all of those things play a role, and all of those things need to be addressed. That's why I'm such a huge advocate of, if you are only looking at bladder-centered treatment options for your interstitial cystitis, then we're missing a huge piece of all of those other things. So I just really want this to hit home for you guys. I want you guys to embrace the fact that we might not know exactly what to call it, but we know how to treat it. And that is what matters for your healing. That's what matters. And so I am really passionate about this. I feel like I want all of you guys to take this to heart, to think about it, to ask your pelvic health physical therapist this issue, to ask them how to help you to figure it out, to ask your urologist, what the heck, can I have this other part of this? Why? Right? Is my back? I had a person on a remote consult talk to me about her scoliosis. She was like, everybody says my scoliosis isn't a thing. I was like, why not? Of course it can be a thing. How is it not a thing? It's like a huge curve. Gosh, you guys, I just get really fired up about this. Okay, so hang on. Leah, I've got your question, girl. Can all this involve the stomach and cause nausea? Yes, 100%, right? Not because the bladder is linked to nausea, not because your pelvic floor is linked to nausea, but because that cycle that we just drew is an extremely scary cycle for your body to be in. So it automatically puts you into a sympathetic nervous system fight, flight, freeze response that we have to break. Can some nervous system upregulation from all of this stuff cause nausea? Yes, 100%. Now, we also have to rule out other factors of nausea, but anxiety and all kinds of other things. So people that have generalized anxiety disorders, either because you're dealing with all this stuff or because you had that previous to it, can also be a reason why your body is hypersensitive to pelvic floor dysfunction, to bladder irritation, to food, to inflammation. All of that matters, and you need to take it into account. So I'm going to finish up this here, and then I'm going to get to your questions here at the end. So we already talked about the mindset shift alert. Does it really matter? I want you to really think about that for you. I'm going to put this quote up again, you guys, because this is where it's at. When you improve a little bit each day, eventually big things occur. Don't look for the quick, big improvement. Seek the small improvement one day at a time. That's the only way it happens. And then when it happens, it lasts. We do not have to fix all of those things that I just listed off in one visit, you guys. That's just not possible. It's not probable that that's going to happen unless you believe in miracles. I do, but Lord knows that doesn't happen all the time, right? So what we can do, though, is we can start to look at each individual thing in this contributing factors to my symptoms worksheet and think of, cool, if this is 10% and this is an easy thing to fix, I'm going to fix that. That's 10% better, right? Little improvement. If this pelvic floor dysfunction is 50% of my thing, I'm going to even pare that down and look at the reason for that. If it's because I fell on my tailbone, I'm going to attack the tailbone problem. Boom. Pelvic floor now is a little bit better, and we've knocked it down just a little bit more, right? And each incremental improvement is going to be a more lasting of a change than anything else. When this works, you guys, people say things like this. It's life-changing. I never thought I'd get over pelvic pain and be able to come as far as I have. At each visit, I learned something new. This is what you should be demanding of your healthcare practitioners. the interstitial cystitis solution. I hope it's helped many of you people to take back and to hold your clinicians' feet to the fire. Help me figure this out. Take this webinar, take a screenshot of that ICPFD thing and show it to them and be like, help me figure out where I can most easily break this cycle with you. How are you best equipped to help me break this cycle? For some urologists, right? For some urologists, it might actually be that they can help you with the UTI, or they can help you with a bladder treatment that's going to help calm down that dysfunctional voiding pattern. Maybe they can. Maybe a pelvic PT can help with the pelvic floor dysfunction piece of it. Maybe a psychologist can help with that threat message part of it. Maybe it's more than one person that needs to sort of insert themselves and help you break that interstitial cystitis pelvic floor dysfunction cycle. So it's usually not either or, you guys. It is usually not either or. It's usually both. It's usually both pelvic floor dysfunction and some sort of nervous system regulation and some sort of nervous system calming and some sort of retraining that brain bladder connection. Most of the time, a pelvic floor physical therapist, again, remember, that's why I introduced myself. You got to know who you're taking this training from. Most of the time, I believe that we're best equipped in all of the medical team to help you get out of each one of those areas with a little bit of help from other people, right? We need a good urogynecologist or a good urologist. We need a good person that we can go to for some sort of cognitive behavioral training, trauma-based therapy, something like that, if that's a factor for you. If your pelvic floor physical therapist isn't well adept at treating orthopedic type pain, then we need to get an orthopedic physical therapist on board that can help that sciatica, that can help the hip pain, that can help the groin strain. Okay, so we need to make sure that we're addressing scar tissue. We need to, both internally and externally, looking at your pelvic health history. All of those things, you guys, can really be a huge piece of this puzzle. And so I'm going to get to all of your questions here in a second. What I did want to do is make sure that you guys knew that this was just one section of the Interstitial Cystitis Roadmap to Healing IC course for patients that I have for you. If you found this helpful, if you want to know more about like how to figure out your percentage of contributing factors, is diet a factor? Is it not? How do I know? What should I do? All of that kind of stuff. If you're dealing with pelvic pain, urinary urgency frequency, if you feel like your practitioners don't understand your condition or listen to you, what's going on, if you're managing the symptoms, but you can't get to the underlying why to help you get lasting relief, if you don't feel like somebody could tell you all of that cycle for you, if you sometimes flare and you don't know why, if you're suffering and you're scared that this thing will last forever, if you aren't sure what the next step should be, this course can be a good thing for you. You can go to pelvicsanity.com, IC Roadmap, and get it there. We're going to do a flare busting plan, a diet and nutrition handout, symptom log handout. If you order during this online training, you get an extra bonus of building your medical team. It's $47 when you pre-order before July 1st. It's going to be available July 1st. If anything here was helpful for you, I want you to consider getting that. You get access to my thoughts like this. We help you to talk to your practitioners. I just really hope that you guys will find this training, got the bladder, find this training, find this thought process, find this mindset shift really empowering. I don't want this to feel overwhelming for you. Oh my God, I have all those symptoms. What am I going to do? What you're going to do is you're going to start with one of them. You're going to get a practitioner that can help you start with one of them. And then you're going to knock them off the list, man. And you can keep moving forward and keep pressing forward because you really can get healing with interstitial cystitis. It is possible and it's probable. And I hope that you believe that for yourself. And I hope that you, believe me in saying that. I've seen it happen. I know it can be possible for you. Okay, I'm going to go to questions now. You guys, please do the questions. Okay, what is your thought on using functional nutritionists to use diet supplements to help cure PFD and IC? I do not believe that any one supplement is ever going to cure IC. I think that functional nutritionists can be a very helpful part of your healing team. And I just feel like the one caveat I have sometimes is that they are, and you guys get this with multiple people, and it's frustrating for you guys. I'm sure it's frustrating for me to see it as well, but everybody's just in their narrow lane, right? So it's like functional nutritionists, as like, well, I'm only going to look at these supplements and these things, and we need to heal your gut, and that's it. And that's it. And like, they're so myopic in their view. And some pelvic floor physical therapists are like this too, where they're just looking at the pelvic floor being like, I need to get this one little trigger point to go away, and then that'll be good. And it's like, it's so much broader than all of that. So I would say that it can be a great adjunct to your team, especially if you're diet sensitive, and we figure out in that course, we actually go through how to figure out how diet sensitive you actually are. And so I think they can be helpful. You just have to be careful with any practitioner that they're not so myopic in their view that they're not also being able to see the broader picture. But if you can identify a percentage that they can help you with, then they can be really helpful. And especially if that percentage for you is big, like let's say you have, I don't know, IBS or something, and a functional nutritionist can help you with your diet to sort of figure out how you can both be nourishing and decreasing your food triggers, then I think that is worth its weight in gold, especially if it's in that symptom thing where it's a big part of your issue. So that is one of the things. Oh, Jennifer, I hope you are still on here. Jennifer says, I've had this for 30 years and I feel like it's too late to fix what's wrong. That is so not true. I need you to get that out of your head right now. We have had people that have come to my clinic that have had it for 25 years. My goodness, 25, 30 years, more than that. And still, it's never too late to address that. If you had back pain for that long, it was not too late to address that either. This is the similar mechanism. It's never too late to address things like that. It might take a little longer to heal. It might take a little bit longer than if somebody had just had the symptom onset like 2 seconds ago, right? But so I don't want to misconstrue. But that does play a huge role in healing. How long you've had the condition sometimes plays a role in how long it takes to heal, but it is never too late. Can you post the website again for the class? I will do that. Hormones affecting IC. We go over this in module 8 of the course. Hormones in general, in terms of the causes of IC, we used to think that it was like, oh, it must be, because we used to think it was women in their 40s, right? And that's why, oh, it must be when people are going through menopause. And that's just shown to not be true. It is true that some people have fluctuations with their cycle, but not, it's not been shown to be a definitive factor for most people. Let's see here. Here we go. God bless you for your passion. Can you please send out that form that you drew on to your emails? That's included in the course, and anybody that comes to see me. What is your thought on using functional nutritionists? We already did that. I'm reading the same darn question over. Do you have a good resource for techniques to break up C-section scar tissue? I highly recommend that you go to a pelvic floor physical therapist to really help you with your own specific needs there. But we do have a YouTube channel where we go over scar massage in that area. If you just go to YouTube and type in pelvic sanity, there are some videos there for you. PFD have anything to do with lichen sclerosis? That is a really loaded question that goes a little bit beyond the scope of this training. What I will say about it though is that lichen sclerosis can be in that category that starts like where I said that there was an infection, right? You can have no problems at all, develop lichen sclerosis, and then insert that wheel or the cycle at that top thing where something irritates these tissues and causes pain and therefore creates that cycle loop. So I will say that. I've had IC-PFD for 10 years now. I've always been told not to do Kegels because my pelvic floor muscles were so tight. I've been doing the opposite, pushing down instead of pulling up. This has helped me to relieve my urinary retention. My bladder's prolapsed and I've been instructed now to do Kegels, but I'm afraid my urinary retention will return. You know, having prolapse and pelvic floor dysfunction and hypertone in urinary retention is a balancing act. I will say this, again, that kind of is a really loaded question, a little bit more for this training right here, but I will say this, if you have interstitial cystitis, you should not be doing Kegels, period, end of story. What you should be doing, you can still be strengthening the pelvic floor without Kegel exercises. And that's where you need to find a pelvic floor physical therapist that can actually do this for you and help you to manage what you need to be doing to fix your prolapse at the same time, not over contracting your pelvic floor. So you bring up a really excellent point. You are on the right track for thinking about it this way, because it needs to be really worked with your pelvic health physical therapist to really find that balance. And it can be found. And I've had many people that have had babies that have had issues with incontinence and prolapse that also have interstitial cystitis symptoms. And we're able to do that balancing act if you understand the core muscle function and the pelvic floor. Thoughts on tension myositis syndrome and its role in these chronic conditions being an essential aspect in healing. Just started reading Unlearn Your Pain. Not sure if you're familiar with that book. I'm not familiar with that book, but I'm sure it's similar to some of this pain science stuff. I personally like people from the Explain Pain group or the NOE group in Australia, and I really like Greg Lehman as well. So those are my go-to guys. I have not heard of that, Jema. So sorry. Trey, good question. What if it is the bladder lining? This is the bladder lining, again, you need to look at that cycle sheet, right? And think about all of those things that it can be. Your bladder lining can be a problem, but statistically speaking, it's less than 5 to 10% of people with these symptoms have bladder lining problems. And there's a big difference between glomerulations, redness, angry bladder, and true ulcerations. Okay. So there's a big difference. So in those two things, so we're talking ulcerations is true bladder lining pathology. Anything else from the research is shown to be actually just as common in normal bladders too. So what is really going on? Is it truly the bladder lining if it's not ulcerations? Usually the answer is probably not. It can be, you need to think about outside the box. So I want you to broaden your horizon. And unfortunately, there's a lot of things you'll read that talk only about bladder lining. That's the basis behind installations. That's the basis behind hydrodistension. That's the basis behind Elmeron. That's the basis behind aloe. That's the basis behind a lot of things because that's what we used to believe about the condition. And now that we know so much more that it's a pelvic floor, a nervous system, a brain bladder connection, and maybe a little bit of the bladder, an inflammation problem, or nervous system autonomic dysreflexia, right? There's all kinds of other things that it can be. So to think about it, that it is just the bladder lining is really leaving short on this sort of sheet here. I'm going to answer just a few more questions. Trey, I'm going to call you out again. Good job. IC frightens me, and I've been having the symptoms for 10 years. The diet frightens me most. I cannot tell you how many people have this fear around food. That's why in the course that I had the link to, that you really need to think about really need to think about, are you actually as diet sensitive as you might be feared that you are? There is so much misconception around the IC diet. 3 of my 8 IC myths are around diet and bladder lining stuff. So anyways, that is just my thoughts on that. So I would encourage you to look and see and actually do an elimination diet to see what your thing is. Yeah, a lot of people said, when I asked that question, having IC frightens me. I've had a lot of people also say that having both frightens me. And really at the end of the day, most people have both anyway. So but we want to look at, why does that happen? Number one, why does that make you fearful? And most of the time, if you really dig deep, your fear is based in the fact that you don't believe, you haven't heard, you don't know that you can heal, and you haven't seen any evidence of that yet, and that the symptoms can go down. So the fear is actually in not getting better, not of the condition itself, right? If someone told you that you would 100% be doing it, then maybe you wouldn't be fearful at all. A couple other questions here. What about having the habit of holding your urine? Can it cause pelvic floor dysfunction? Yes. If you look at that cycle that we had, that is part of the holding back your urine, or not. Teachers a lot of times don't go to the bathroom a lot. That can be a hypertonic pelvic floor causing an inability to relax fully to go, causing incomplete emptying, causing your brain to be like, whoa, needs to send a message to pee, causing urinary urgency frequency, and then now you're in the cycle. So 100%. Is there a correlation between endometriosis and IC? Yes, a big one. They call them the evil twins. I have a lot of resources on my Instagram TV about this, on pelvic sanity. Now we're up at the tailbone stuff, right? We talked about all of that stuff, so that's good. Perfect. Oh, Paula says, yes, I'm a teacher. I knew it. Here we go. Link to the course. Hopefully we'll get that fixed. If it doesn't work for you guys, I think we'll figure it out here. Elizabeth, last question. The low gag lining of the bladder, is that the same as the bladder lining? Yeah, the gag layer is, so the bladder lining, so inside your bladder is a muscle called the detrusor muscle. And then also this lining of the bladder is also known as the gag layer. It stands for glycoaminoglycan layer, and it's the molecule that it has on there. Could IC caused by PFD create Hunner's ulcers? I think my PFD came first, but I've been diagnosed with Hunner's ulcers. That's actually a really good question. I would say the first part of that is no. IC, it's in and of itself, PFD cannot cause those ulcerations. But what you maybe have noticed is that you had ulcerations, or maybe a low-grade ulceration that was not symptomatic. It got worse or more inflamed, and your pelvic floor dysfunction you believe came first, but that's the sign that actually showed up first. Didn't mean that you didn't have Hunner's ulcers. It means you didn't have the testing done before you had symptoms, right? No one was looking at your cystoscopy before you had that. So there's no way of knowing when those came about, because you can have Hunner's ulcers and not be symptomatic. So that is one of those things. I see that some of you guys are having link issues. We'll get that fixed up. Petition for teachers to allow students to go to the bathroom during class. In high school, we weren't allowed to leave class. Seriously, that is a problem, big time, because it can lead to that holding pattern and being afraid to go. I'll share with you one little other story that I had, and this might resonate with some of you people. But I had a patient who actually has really bad childhood memories of her parents getting really angry whenever they went on road trips, because she had to go to the bathroom a lot. And so she would be scared to go to the bathroom, and she would hold her urine really a lot. And then every single time she actually did have to go, she would have a hard time going, and then they would get mad at her. And it was just this really cycle of fear around urinating, holding the urine, having a hard time going, incomplete emptying. She used to get bladder infections. She used to wet the bed a little bit longer into her life, like maybe until she was like 10 or 12. And her parents really were basically made her very shameful about that. And that, I think, was a big contributing factor to why she had this holding pattern of pelvic floor dysfunction and ultimately diagnosed with interstitial cystitis. The cool thing is that we were able to have her go to EMDR therapy. And we were able to have her do pelvic floor training and get her nutrition all dialed in. And she is almost pain-free now. So that's a happy story of somebody that even somebody whose why extends way into childhood stemming from trauma, you can actually heal and get all better. So yeah, so I hope you guys, I'm going to put up this again. I'm going to share this screen again so you guys can see the link. I thank you guys so much for coming on. I really, really, really appreciate you guys being here. I hope this was helpful for you. I want it to be empowering for you. If I did not get to your question, if you can email me at frontdesk@pelvicsanity.com, I will be happy to answer your question. I want you to have an empowering, I want you to be empowered by this lecture and this training. I want you to think bigger. I want you to think broader. I want you to not be fearful if you have both things, because I want you to think about that the treatment for them is the same. And so I don't really care what the heck you call it, interstitial cystitis, pelvic floor dysfunction, both, neither, but you still have symptoms, then we need to meet with you. And you need to find a practitioner that is passionate about helping you, that is willing to go through this journey with you, that can find your why to your pelvic floor dysfunction. And all of that can be putting you on the path and on the road to your final destination of significantly decreased symptoms, even to the point of being symptom-free. Paula, you're here. Thanks. You're a patient at Pelvic Sanity. You're on the path. I really thank you guys so much. I hope that so what you guys will do with this too is you're going to, in the next, I still have to like stop recording and figure out how to upload it and everything, but I will be able to upload it, and then you'll get an email with how to access the recording of it. So I hope, and I think if you add IC roadmap / works, need to add the last /. Thank you so much. We'll get that all dialed in for you, and we'll make sure that we send you an email with that information as well. The course is going to be really cool. I've never been done before. I don't know of any resource that you guys have for that. What's cool about it, I'll give you a little inside track real quick, is that so when we wrote the IC solution, I don't have it here with me, of course, because that would have been too smart. But I wrote the IC solution, and it kind of had to be very like evidence-based and very diplomatic. And this is what we're going to present, and this is what we're going to do. This course was super fun for me because it's basically what I get to tell all my patients. I'm just like, you know what? The veil's off. Like, what do I really think? What do you really need to do? What is important? What's not important? If someone tells you something, I give you my opinion on, like, you know, if a urologist says X, this is dumb. If a pelvic PT says do Kegels, you need to find another one. Things like that, where I feel like I get to be a little bit more like, frankly, just like opinionated. And actually share with you guys what I actually am able to share with my patients. So, you know, it's not as good as coming to Pelvic Sanity, right? But it is something where it takes you through all of the education that we give to our patients. And it gives, you know, you basically a roadmap for, at the end of that course, you will be able to say to yourself, I think I have a I think I have a path. I think I know which freeway I'm going to take to that destination. I think I know that if I hit a roadblock and I need to go a different way, I now have the tools to be able to do that. If I get derailed and get lost, I know I can come back to that course and find my way again. So I feel like it's going to be another way to be really empowering. This is one part of one module of 8 modules. So this is like, I forget what it is, but let's just pick a number, 7.4. Like this IC roadmap thing, or interstitial cystitis or pelvic floor dysfunction, is like one part of one module. So if that gives you any, you know, I don't know, any like impetus to go and get the course, it is going to be available until July 1st at that price. So that's it. I hope you guys have a wonderful, wonderful night. Again, if I did not get to your question, please email me at frontdesk@pelvicsanity.com. I'm going to share this screen one more time so you guys have the contact information. Looks like we might need to do a / at the end here again. But again, frontdesk@pelvicsanity. Pelvicsanity.com is our website, which also has a lot of information. And if you're not already on the online support group, Finding Pelvic Sanity, we do stuff like this in there a lot as well. I really hope you guys have a wonderful evening. If it's late for you, thank you so much. If it's early for you, thank you so much. And I am going to go have dinner now. Appreciate you guys. Thanks so much. Bye.